I was at the time at Kaiser Permanente, and I remember we were moving things faster and more effectively, better than I'd ever seen in our system. And that's because we came together. So I really am a believer, this is what energizes me. If we come together and we set a common goal, and I talk about different stakeholders, we can get to a solution.
When I started inspiring women, I had one clear mission to advance the next generation of women leaders. This show is for you. Whether you're climbing the corporate ladder, building your own business, or navigating the complex world of healthcare leadership. That's why I'm asking you to please take a few minutes and fill out our quick 5 question survey. Your feedback will help shape the future of this show, what topics we cover, which guests we feature, and how we can best support your leadership goals. Visit inspiringwomen.show/survey to share your thoughts. That's inspiringwomen.show/survey. Your voice matters, and I can't wait to hear from you. Now, on to today's guest. This is Inspiring Women. I'm Lori McGraw, and today I'm really happy to welcome Dr. Sarita Mohanty to Inspiring Women. She is the president and chief executive officer of the SCAN Foundation. She is leading a national philanthropy. She works on policy. She works on serving the underrepresented, the underserved. She's interested in a leader in providing that intersection of how a foundation, an arm of a health plan, can actually advance both policy and how we make that happen in today's environment. Dr. Mohanty, thank you for being on Inspiring Women.
Thank you for having me, Lori.
This has been a conversation a year in the making. I reached out to you before. I'm just very impressed with your work and your background. And wow, what amount of change has happened over the course of the year. New administration, new ways of working with this administration, the Health and Human Services and the policies coming out. I'm not keeping up with them. I'm sure that you are, Dr. Mohanty. Before we get to all of that, maybe let's just talk a little bit about what the SCAN Foundation is and a little bit about your non-linear path to getting there.
Wonderful. It's again a privilege to be here and talk to you, Lori. I'm Sarita Mohanty. I do serve as the president and CEO of the SCAN Foundation. We are a philanthropy, a grant making, and impact investing organization that focuses on what we describe as bold and equitable changes in how older adults age in home and community. And really, we believe that all of us, every one of us, needs to age with purpose, with dignity. And that's really our foundational elements of this organization. We were incorporated in 2008. We were created by the SCAN Health Plan and actually created to be independent from the health plan in a lot of ways, although we do continue to connect and really focus on the mission of the health plan, which is around serving older adults. And so that is really core for us as a foundation. We are really intentionally focused on home and community care, long-term service and supports, home and community-based services for older adults through our grant making and impact investing. And we do focus on those populations that often are historically marginalized, underrepresented, underserved. These are low-income older adults from that are in the rural settings where there's under-resourced resources in that area, communities of color. So we are really activating our efforts. And what we're doing is we're trying to see how we can inform policy as an organization. We are looking at what are the data insights, what are both the qualitative and the quantitative insights that will inform and accelerate effective policies. And so that's a little bit about us as a foundation. And Just a little bit about me in terms of my career path. I am a practicing internal medicine physician. I started my career in health services research,
Practicing
and
today, practicing
yeah,
today.
I
With
do.
this
I do. I actually
enormous job that you have, you are still practicing. That is amazing.
Yeah, I love it. I will tell you, I mean, people ask me this all the time, like, how can you practice when you have this, full-time job that really takes a lot of time and commitment? And I said, look, I've always liked clinical practice. I always have. My challenge when I was starting to train and then go into the system was I found, and this is like 25, 30 years ago now, that the system was not working for the people in the most effective, efficient way. And I wanted to step outside and do a little bit more to try to see how I could impact, change, make the system better. That being said, clinical work gives me an opportunity to really engage on the ground versus being at the 50,000-foot level. I get a chance to see how patients, who come into or I do urgent care mostly, come in, what their challenges are, what's working for them. So I feel like I get that connection, and it also keeps me, clinically challenged, and I like that as well.
So for
So
our audience here, so I came to this call with Dr. Mohanty, and I'm just coming from the urgent care because I sliced my thumb, and she immediately went into physician mode to counsel me, like, am I okay? So thank you so much for being that caring physician. But starting on that physician track and then moving into leadership, and not just the work at the SCAN Foundation, you have many instances of strong leadership positions before that. How did you go from being, again, a physician is a big job in and of itself, to then take on other leadership positions, again, keeping that clinical practice as an important sort of like North Star for you is amazing, but the leadership path, and how did that advance for you?
yeah, and I always describe my career as little bit nonlinear in its process. I always went into anything I did with a lot of curiosity, like why are we doing it this way? Why aren't we doing it this way? How can we make, in this case, systems better? And I've really been focused throughout my career on the more underserved populations. Start with immigrant populations. I worked at LA County General Hospital, LA County USC, previously known as LA County USC. And so I used to see people waiting, that didn't have insurance, wait lines going around and outside of the building, people waiting for days on end to really get care. And it really challenged me and concerned me. So I think as I was going through my career, I realized that I wanted to learn about different aspects of the health system. So I learned about the provider side. Of course, I was working in the hospitals and the clinics, but then I also eventually went to the payer side, the insurance side. I got a chance to work at LA Care Health Plan. One of the leaders gave me an opportunity to learn the ins and outs of what a health plan does in terms of managing risk and overseeing provider networks. So I got to do all of that utilization management, care management, oversight. So it really gave me a different view, and also, again, there was just so much opportunity to build more effective systems. And then I did then go to Kaiser Permanente to continue my work focused on Medicaid. Predominantly, and the dual eligibles, those are on Medicaid and Medicare both, to focus on really social drivers of health. Like the idea was, we can take care of these populations, but we got to be thinking a little differently because most of, they're low income, and their primary health drivers are often social health issues like housing, transportation,
Yeah.
food, et cetera. So I got a chance to start to think about how do we coordinate outside of the four walls of the health system at Kaiser to think about working with community-based organizations. And it afforded me the opportunity to take on some leadership roles to create large programs, like a program called Thrive Local, which was an intersection between the health system and community-based organizations. So
These
uh,
issues
just
are these issues are always sort of multidimensional. There's never enough resources to solve the problems, at scale that you're talking about. Let's talk about the population that you're just front and center with the Scan Foundation today. Older adults with less resources available to them. First of all, like what are the issues that we should what are the main issues? We know that people are living longer. We know that people are living with more than one chronic condition. They might be on multiple medications. They may or may not have the financial resources to pay for those medications, let alone adhere to the regimens that come with them. And but there's other things. I've talked about the loneliness epidemic, which seems to be on the rise. So, what are the key issues that you're thinking about, and then how do you go about trying to address them at the foundation?
Yeah, you've touched on so many of the core issues. One, the demographic shifts. By 2030, 2035, they're saying that we're going to have more older adults than children in this country. And one of the biggest, challenges, and you touched on the fact that with the recent policies underway around, let's say, Medicaid cuts, how is that going to impact home and community care and support services for those that are particularly dually eligible for Medicare and Medicaid? Because so we're worried that some of those services that currently exist for those that have Medicaid because they're low income might be on the chopping block, so to
Really
speak. And
worried. I mean,
yeah,
really worried.
yeah,
These are
yeah.
dramatic changes that are being put in place from a policy perspective. I mean, can you just like maybe like beyond the theoretical, like what does it actually mean if those programs go away?
Yeah, if those, so I'll give some examples. If you go and for example, there are older adults who rely on a service here in California, and we work both California and nationally on community-based adult services, or they call them CBAS. And this is an opportunity to go to an adult day health center where you can actually get some time to deal with some of your clinical issues, but you get social supports. It also sometimes gives the family member, the caregiver, a little bit of respite, because versus them having to care for the individual at home, this person an individual can go to these CBAS centers. And it's usually for those that are more at risk for eventually going to a nursing home. So we call them nursing home certifiable. And you want to prevent these individuals from going to a nursing home. So giving them the supports in the community. And that is considered a long-term services and support benefit of Medicaid. And those are optional benefits for states. So when money doesn't come to the states, it's conceivable that that service might, be cut because they're not required per se by the CMS. And so that's an example. I mean, Medicaid also covers what they call personal care attendants, or in California, in-home support services, where people can go in the home and help older adults or anybody with that is on Medicaid with their activities of daily living and like bathing and other things that they may need help with. So needless to say, the take home of this, if those are cut, then where are people going to get care? And if they start to get worse, their first resort is going to often be going to the emergency department.
ER, yeah.
Yeah, yeah.
So Dr. Mohanty, in terms of you had talked earlier about policy making and influencing policy making as an important place to do your work. Um, uh, is it possible? I mean, again, the world has changed in my view, and I'm not close to policy making. I will tell you, I was at the American Medical Association, and I got to see firsthand how that work was actually done. It's amazing, but it seems less clear to me in terms of how policy making is being done today, where the influence is, how to influence. How do you do that work at the Scam Foundation, and how has it changed for you? Is it still possible to influence policy making in today's environments? What do you think there?
Yeah, I think anything is possible. And I think when you're in situations where you're seeing potential risk for care and affordability and quality, Needless to say, we need to find ways to inform and make sure we can inform policies and find ways to accelerate them, to make sure that there are incentives in place so that, there is like reimbursement for those types of services, and knowing that there's a return on investment. If we pay for these types of services, even social services, that you're going to reduce avoidable high cost utilization, like emergency departments, like inpatient care. So we think that is really important. And so for the foundation, the way we think we can really get into the hearts and minds and of policymakers is those, first of all, ensuring that we bring multiple stakeholders together, knowing that this is an issue that we all have to address together with public partnerships, private partnerships, government, in other industries, bringing them in, advocacy organizations, bringing them together and saying, here's what we come up with, policymaker, that you should really consider. And then the other thing is, I would say is, it's not only the like I mentioned, we've talked about a little bit, is that we can't just rely on hard quantitative data, very important. But at the end of the day, hearing from the people and what they're experiencing in the system is really, and like then saying, okay, if the system is getting more compressed, less incentives, then here's what's going to happen. I mean, we have a platform that we helped put together in partnership with another organization, the Public Policy Lab, called The People Say. And we are curating stories, anecdotes from older adults from like 10 different states, red, purple, blue, and on different demographic profiles. And, what we're hearing is that there's a lack of comprehensive and seamless coverage. For example, we have a quote from a patient who said, when everything costs money, many people just avoid going to see a doctor if they can.
Yep.
Yeah. So these are the kind of things that we're pairing a lot of our informing with really qualitative stories, because the more people can see that in their own state, in their own jurisdiction, the more they realize that this is going to hit home, hit
Dr.
them.
Mohanty, those things that you're doing, those sound like the right things. They sound like, the best practices playbook for how you go about things. You are an experienced leader. You are a physician. You continue to practice. So that is clearly critical to you. You've worked with underserved populations. You understand the needs are complex and the situations, in many instances are actually becoming more dire. So I'm curious, in terms of you as a leader, an experienced leader, how are you showing up as a leader differently today, given what I would say are new and additional and perhaps larger challenges to advance your objectives than it's always been challenging to serve the underserved in ways that are impactful, helpful, better outcomes. It's always been challenging. I believe it's only become more challenging. You're affirming that. So, as a leader with all that experience, what are you doing differently today in today's time because of the circumstances you're up against?
Yeah, I think it's almost doubling down on, one is like shaping the narrative of across, to everyone, and we are saying that, aging is universal, that shared reality helps us, cut across all party lines. We really take the time to understand, like in this case with policymakers, what each lawmaker values, and frame like aging issues in ways that connect to their priorities. And we're finding creative ways to do that, important ways to do that. And then, like I said, elevating the older adults' voice and community voice. Like the more health is local. We always say that health is local, and the more you can bring the community voice and let particularly older adults feel a sense of agency, that they can inform the policies. It becomes much more about people and community lives. And so that's, some of the things in this time. We are, we're, as I said, grant making. We're also doing impact investing because we feel there's an opportunity to catalyze innovation in a time where, if we've been doing things for 25, 30 years and still the system is not working well, we need to be also at the table helping to de-risk projects that could be innovative and scalable. And we've done that with different venture funds and direct investments that we think will really serve our priority populations. And then we have a special projects budget. Like we make sure we have the flexibility to act when acute needs arise. Like when, for example, when the LA fires hit, we provided support to organizations serving marginalized older adults who are hit hardest. And we actually worked very closely. We leaned in on our partners who are closest
But
to the
how do you
community.
do it, Dr. Mahanti? I mean, these are, again, enormous issues that are out there. And at a time when, I mean, honestly, listening to all that you are working on, I mean, that sounds amazing. It requires, I have to imagine, a seemingly infinite amount of energy, some
Yeah.
optimism in the face of facts that suggest, optimism might not be, the most available thing. So, where's the energy coming from? I hear you saying you're needing to double down, but there are so many women leaders in positions like you where there are more obstacles, not less. Things that look like obstacles in the rear view mirror, like, oh my gosh, you think that was a problem based on what's today. So where is your energy and optimism coming from? And how can you channel that for listeners who are looking and needing to solve similar type large scale issues like you are facing?
Yeah. No, I really appreciate that question. And it's really people ask me this, what drives you, what gives you the energy is I think it goes back to my values, my core values. It's about, really thinking about, leading with empathy and humility, leading with equity and inclusion and, leadership, and leadership is important. Innovation is important. Those are some of my core, the core values of our foundation. And so for me, it's like, okay, so now I have to, what surprised me and energized me was like how much I had to reinvent myself as I moved from like the exam room to the boardroom. Because in medicine, you're trained to diagnose, treat, kind of act defensively. What I wasn't trained for was running an organization, reading a profit and loss sheet, or thinking about strategy. And I think what's exciting me is I'm a constant learner. I'm very curious. And I always ask the question, I'm like a little kid. Why is this way? Is it this way? Why isn't it that way? And I feel like I feel that is what really keeps me going because and what is a great example is what we all saw during the COVID pandemic. We saw at that time, that we were, so much strain. People were dying of COVID. We were completely locked down. I was at the time at Kaiser Permanente, and I remember we were moving things faster and more effectively, better than I've ever seen in our system. And that's because we came together. So I really am a believer, this is what energizes me. If we come together and we set a common goal, and I talk about different stakeholders, we can get to a solution. So that's what drives me. It's like, how do we get to that yes, and we're going to do that. And, and it requires like risk taking. It requires a certain amount of resilience. Like medicine for me, it always teaches me to avoid mistakes, but leadership requires you to take risks and sometimes fail forward. And I think during that time where we had so much to lose and during the pandemic, people felt, okay, let's just do it. Let's not
Yep.
like overthink this. And that's what really excites me. And then I also see tremendous leaders that are out there doing the same thing, pushing the envelope. Because I'm going to be honest, I am really frustrated and concerned about the broken healthcare system. And I really feel that, we have to, we could kind of be complacent or we could say, no, I want to make the healthcare system better I have 3 kids. I want to make sure that they don't have to deal with these challenges. Or as I'm aging or my mom is aging, so that also drives me. There's a personal commitment that I also think that keeps me going. I'm also just always wanting to grow as a human being. And like I said, being curious is what drives me.
Well, I think I will just say, listening and having the opportunity to speak to so many women leaders, it is my view that in these incredibly uncertain and challenging times, first of all, bold leadership, determined leadership is required. I also believe, and you are demonstrating that women are equipped and uniquely fit to lean into this bold leadership because of the authenticity, the empathy, needing to take a lot of different voices and bring them forward. So I appreciate you supporting. You're just like adding to my collection of, yep, she said all that. Um, if we could just close out, this is such a great conversation. I so appreciate you being here. Your advice to other women leaders who are up against the same, wanting to have the impact that you are having. Dr. Mohanty, if you could just give us last closing advice on inspiring women.
Yeah. Well, I always say that, as we think about reshaping, in this case, an entire sector, aging, healthcare, whatever you're doing, one is like mentorship and coaching. I think we also need to pay it forward. So as you're getting, I get a lot of mentorship, but I also want to make sure that we can coach emerging leaders, especially in my case, the physicians who want to do like I was back 25 plus years ago, saying I want to do more to build to transform the system. And I think for women, I think it's like building confidence in your abilities. That and making sure like for me, I had to go back and I went to business school. I didn't have to go to business school, but I wanted to because I wanted to really start to think about strategy, finance, and taking a risk because, at that time I had three small kids, but I felt like that was going to be an important part of my career development. And then like I also say model inclusive leadership, making space for listening, like going to the community, listening to people, elevating diverse perspectives and showing that leadership isn't about having all the answers, but by listening and collaborating. I feel like that, that would be my, because I think the next generation learns not just from what we say, but how we lead. And so as women, we want to be able to demonstrate that so that we can get that next generation going. So those are some of my take home kind of points. And I think that's really my first personal philosophy. It's about leadership, multiplying impact. And it's just not enough for me to lead. I need to create the conditions, really at the end of the day, so dozens of others can carry this work forward.
Well, thank you for that. You've certainly demonstrated it in this conversation. Dr. Mohanty, thank you so much for this inspiring women conversation.
My pleasure, and really appreciated the conversation today. Thank you.
What an amazing conversation that was. Hey, this is Lori. Did you know that we have a newsletter with exclusive insights and resources to help inspiring women like you? It's completely free. You can sign up at inspiringwomen.show. Be sure to check it out, and thank you for tuning in.